Hello everyone, I'm Dennis McCarthy with Upper Allegheny Health System in Olean General Hospital, welcoming you to Inside Olean General Hospital, our news and information program about events and services and programs at Olean General. We have a special program today, and with us today is Dr. Christopher Malavarapu, an interventional cardiologist with Olean General Hospital, who's just joined us in the last couple of months and is the medical director of our interventional cardiac catheterization program. Welcome, Dr. Chris.
Thank you, Dennis.
Doctor, can you explain the issue of heart disease in the country and here in our region?
The most important things that revolve around heart disease are, number one, cholesterol problems, smoking, stress also plays a very big component of heart disease. And, a heart attack that happens or a stroke which happens before the age of 75 is largely preventable. And we have sort of, changed our lifestyle over the years from, becoming a society where, in terms of farm-based, trying to do a lot of stuff on the land and walking, to where we spend a lot of time in front of the computers, we eat unhealthy food, we may exercise, we may not exercise as much. So a combination of things, combined with unhealthy habits, cause these problems, and society has to respond.
So some of this is avoidable, is what you're saying.
Yeah.
There's a way that people can help protect
Definitely.
themselves.
Right. If you don't have diabetes, if you don't get high blood pressure, if you don't smoke, your cholesterol stays less than 180, and you make it to age 50. So the goal is to really make it to 50 with optimal risk factors. Then on the average, if you can do that, then on the average, a U.S. white male will live to be about 88, a U.S. white female lives to be 89, but only 1 in 20 Americans makes it to age 50 without messing up, as we say. They tend to have some problems. And so the goal is, if we can educate our patients to help avoid these problems, then they can prevent these future episodes from happening.
So basically, a lot of this is under our control, and I guess the point that we're going to get to and talk to in a minute is here at the hospital, we do have some special capabilities now, but this region is not very good when it comes to heart health either. The southwestern New York and the Pennsylvania area, for what we know, is very prone to heart disease, and they have a high rate of mortality here.
They have a much higher rate of having acute myocardial infarction, and they have a higher incidence of mortality from cardiovascular disease and stroke. And so I think the goal of this hospital and the goal of the program is to, number one, if they do have a problem, to try and fix it immediately so that the damage is not too bad. And number two, to help prevent and educate the local community to avoid these problems in the future. A primary prevention and secondary prevention is called.
So I guess on this part, your message would be eat right, don't smoke, exercise.
Right. I think the American Heart Association has various programs like trying to promote, taking 10,000 steps a day. You have to understand our genes are thousands and thousands of years old, and we were not designed to be in front of a computer all day clicking buttons. Our real goal is to look all day for food. And most of the time, all you find are nuts, leaves, and berries. And in fact, there are very famous politicians who had heart disease, and they've had to prevent future heart attacks and strokes, and they try to become vegetarian. Some of the programs that are advocated out there, if it has a face or if it has a mother, don't eat it. Trying to become as vegetarian as possible.
So if it's growing out of the ground, you're better off. Better off eating. Now, okay, so not everybody's doing that, and we have a problem. And one of the things that I know that doctors worry about is, people who have a heart attack may not recognize the symptoms and may not do anything about it. What are some, and we can talk about some of these, the signs or symptoms? If you're in trouble, you need help right away. Right. But what are the signs and symptoms that somebody should be very aware of and not ignore if they're having chest problems or heart problems?
Well, heart disease, usually can present typically or atypically, but, if you're having any kind of heaviness, pressure sensations in the chest, if the pressure radiates to the neck or jaw, goes down the arm, funny feelings, abnormal sensations, especially in women. Women can present a little bit different than men. So all those are warning signs, nausea, any of those things can automatically prompt, you should be calling 911. If your mom and dad had a heart attack before the age of 50, that's also a big early warning sign, And and if you have risk factors, women who smoke tend to have their heart attack a lot earlier than women who don't smoke. So all these things should make you heightened sense of awareness. Say, this could be a heart attack. Let me call 911.
When you do have a heart attack, there's damage being done to the heart, and I know physicians talk a lot about time is muscle. Maybe we can talk about what that means a little bit, and really the urgency to get help quickly.
Well, I think most heart attacks occur with blockages which are less than 50% blocked. So the patients really will not have any symptoms really. So when a heart attack happens, it's just bad luck. You maybe had a stressful day or something weird happened and your blood pressure went up and a plaque ruptured. So as soon as the plaque ruptures, if the plaque totally ruptures and includes the blood totally, to the muscle, then we call it what's called a STEMI, an ST elevation MI, and the heart muscle starts dying instantly from that time on. And we would like the patient, who has, or the person who's having the chest pain, to immediately contact 911 and to try to come to the cath lab as early as possible. The American Heart is saying now 90 minutes, they want you to be there with the balloon open up their artery, to get timely access to care and opening up their artery. So because otherwise you end up getting irreversible heart damage that occurs too long to open it. And then once it's irreversible, then you have a whole other problems. You get heart failure, you may end up dying, you may end up needing a transplant, or you may end up with other terrible things, those kind of things.
So that you need to pay attention to these symptoms. You should get help, because once a heart attack begins, it's going to start hurting the muscle to the heart and degenerating it, essentially, is what you're saying.
Yeah, essentially that. It starts dying immediately because of lack of oxygen.
Well, fortunately, we have a pretty good answer for that here in Olean now with the new interventional cath lab, which, as we said earlier, is really a function of Olean General Hospital and Kaleida Health and the Gates Vascular Institute. And you're our new physician who helps people with these problems. So we can talk about it. You're actually on staff at Olean General Hospital and medical staff at the Gates Vascular Institute in Buffalo.
Yes, right.
And let's talk about what's the kind of work. You're an interventional cardiologist or interventional catheterization cardiologist. What's the work? What kind of functions?
Yes. So what we do, Dennis, is that we try to use catheter-based procedures to treat acute problems that are causing patients to have chest pain. So we, will put tubes in the body using combination of tubes and wires to look at blood vessels using dye, and then if we identify a severe obstruction, or what we may call, a layperson may call a blockage, we will look to see if it's causing an interference with blood flow, and then we may put a stent in to help improve symptoms or help abort a heart attack.
So what we get, a catheterization is a small incision to examine the heart, and those incisions are placed, from what you told me earlier, either in the wrist or in the groin area.
Right.
And then there's a wire. Why don't you take
so
us through?
What we try to do is we try to do more and more of our procedures from the wrist. So the idea is that a lot of times we palpate the wrist artery, and we puncture it, we sedate it, we sedate the patient, and a tiny tube goes in, and through that tube we put wires in, and through the wires we put catheters. And
catheter is just an examination.
Yeah, that's a hollow tube essentially.
Okay.
And through the hollow tube we inject contrast or dye to diagnose the problem. And then once we diagnose the problem, through the hollow tube we then put a wire, and then over the wire we then put these pieces of metal called stents, which sometimes have coatings on them.
They're actually small, tiny cages.
They look like ballpoint springs.
We'll show one here.
They look like ballpoint. Yeah, they look like ballpoint springs of a pen, essentially.
Very tiny.
Tiny, yeah.
And they go in, and then they spread out.
It'd be expanded usually.
And they press the plaque away. Is that how it works?
That's what it does. Yeah.
Okay. Now the angiogram itself, the examination, the dye goes into the veins of the heart, and you're physicians like you are actually watching it on a monitor.
That's exactly correct.
And pinpointing exactly where those blockages are.
Right.
And then you go in if you have to place a stent. Now there may be cases where you don't have to do stenting.
Yeah. So a lot of times stents are most useful, in my opinion, for patients who are having an acute heart attack. And that they're very useful in those cases. A lot of the patients who have mild blockages, mild to moderate blockages, can be treated with medicine, and that's our goal really. And a lot of times, we tell patients, listen, you have a blockage, but you're best off just taking medical therapy, and we reserve stents for those patients for whom medical therapy fails and
Right.
they're having symptoms despite what we call optimal medical therapy, and then we put a stent in those patients usually.
Now, a lot of this may sound a little scary to people when you hear about going through and putting stents in and that sort of thing. But really, it's a fairly simple procedure and doesn't take all that long. Is that correct?
Right, in experienced hands, I think the procedure can be done very safely, and an actual angiogram may only take about can take 10 to 15 minutes. Most of the time is involved in preparation and that kind of stuff. And the most important thing, the angiogram really is the decision, what to do after the angiogram, whether you should put a stent in, whether you should treat them with medicine, whether you need bypass surgery. So those are important decisions that we try to make usually with the family and the patient, and try to what's called informed patient decision making.
Patients do very well with this, don't they?
Yes, I think I've been doing this for many years, and the patients that have done and that we've done here so far have had very good outcomes.
Now, you've done more than a few of these in your
Oh
experience.
yes, I've been doing this since this is I've been doing this since 1995, and I've done well over like 12,000 procedures in cardiac, interventional, and other procedures.
And really, since this lab opened last October, I think we're well over 100 procedures, so you've been very busy.
Yeah, we've done, I think, close to 150 and probably about 50 stents so far.
Have you had, and I know the thing that, one of the reasons this lab opened is because we're down here in Olean. The nearest place to get care would be a place like Buffalo or Rochester, and on a very snowy night, it may be hard to get there, but you've had some success and some really great stories of success, I believe.
Yes, definitely.
With people who've had a heart problem and may have been questionable in terms of making it to one of those larger facilities.
Right.
You've had some cases like that.
Yes, definitely. I mean, the EMS people have brought them in, and a lot of times, the wire has gone down within 18 minutes of them arriving at our facility. And the cath lab people have been excellent, and they've been training for a long time.
And the other that component, the emergency medical services provider, has really been a key to really helping people. And I know you and the team at Olean have been working very hard with the EMS providers to wiring them up.
Yeah. So a lot of times now, if you have a chest pain, the EMS service will come to your house, I guess, and do the 12 lead. And the 12 lead is transmitted right to my iPhone, and we can immediately call the cath lab in, and by the time the ambulance is putting the patient on the ambulance, the cath lab is coming in, so everybody's meeting simultaneously in the hospital, and the patient is brought right to the cath lab, and the artery is opened.
So you're really talking about closing the window.
Yeah,
on
that's
time.
the idea.
Now another big role in here is the chest pain center
Yes.
at the hospital. So what happens? A person
Right. So sometimes patients come in, and obviously not all chest pain is an acute heart attack, and sometimes it's hard to diagnose these chest pains. So we have an accredited chest pain center in New York State, which is one of the very few, I was told. And so they go through a protocol of evidence-based medicine as to blood tests, and then if the blood tests are negative, they end up getting a stress test with imaging to help risk stratify them. And if they're normal, they get to go home. If they're significantly abnormal, they may end up having to have an angiogram.
So it sounds like we got it down.
I'd say that huge progress has been made in the last, in terms of how patients have been evaluated, triaged, and also how to deliver care on a timely, urgent manner with good outcomes.
It sounds great, and I think the success here is a big salute to the team down there, yourself, the EMS providers, Dr. Hilal and the team in the Chest Pain Center, to really try to make a difference. And I think from what you're saying, we are making a difference here, and it's something to be very, very proud of. Well, thank you. Did we miss anything today? Anything else?
I think we're coming to a great start, and I think that obviously a program like this would not have been, it's not just me. We have an entire team of well-trained staff, who are so. There's a whole bunch of people behind the program that would like technology. So.
Well, I guess the message is, first of all, take care of your heart, and if you do have a heart problem, Olean General Hospital has great capabilities now, which didn't exist just a few months ago. And so the word is getting around, and people are recognizing the fact that this hospital saves lives in a whole new way now. Well, Dr. Malavarapu, thank you very much for being with us today, and it's been very, very informative.
Dennis, thank you for your time.
If you want more information on the heart program at Olean General Hospital, just go online to www.ogh.org/heart. This is Dennis McCarthy. Thanks for being with us today.